back, you guys. We are here with Dr. Sally Booth with Booth Dermatology, and I think, Dr. Booth, this is really a subject that a lot of people can benefit from. And you mentioned UltraShape. I read a lot of this, like non-invasive, no pain, no surgery.
Correct.
That gets my attention. How does this work?
Well, it's a wonderful device.
Okay.
And it truly is the only device with no downtime, no swelling, no bruising, no discomfort, both during and after the procedure. And it works by delivering selective acoustic ultrasound waves to the tissue.
Here it is right here.
And as you can see, our patient getting ready to be treated. It truly is a lunchtime procedure where you can come in and in an hour to an hour and a half, have a procedure, and be completely comfortable, and even as soon as the next day go into a bathing suit with no bruising, swelling, numbness.
Well, that's huge.
Yes.
I would imagine, especially, I mean, I would think that there are a lot of candidates for this, but especially women who've had, you know, a baby, 2 babies, 3 babies.
Correct.
It is hard to get, you know, the bellies back the way that they used to be. Do you see a lot of patients in that area?
Most certainly. Patients who, regardless of the weight they're at, they always seem to experience an area such as the belly.
It's hard to get rid of,
That's hard to get rid of with diet and exercise, and that's what it's intended for.
How many treatments would you say? Because if people at home are watching thinking, this looks pretty cool, how many times do I have to do this? How many times do I have to go back, and what am I going to see from it?
Typically, we schedule a series of 3 treatments. Occasionally, a patient who has a little additional fat will want more treatments. But it's typically 3 treatments scheduled 1 month apart, because it takes approximately 2 weeks for the fat and tissue to recover from each treatment.
And I think a biggie here, Dr. Booth, is, does this come back? Is this something?
Absolutely not. If you maintain your body weight and don't put on additional fat, but in that area, those fat cells are destroyed instantaneously and completely, so they do not come back. And they are excreted through our normal physiologic and metabolic pathways as far as the fat that's released from those fat cells.
And I would imagine perhaps this both for men and women. Do you have to be in a certain weight category, or who fits?
Typically, the best client is a healthy patient who's close to their ideal body weight, a BMI, body mass index of 30 or less, which is possibly 10 to 20 pounds overweight, but it's not a weight reduction procedure. It's more for selective sculpting of areas that have always been a problem regardless of the weight the patient is at.
Well, I know this is a problem area for a lot of people, like you said, both men and women, and I know one of the biggest things is you do want to feel comfortable, because this isn't always an issue that people really like to open up about, and I know with at Booth Dermatology, you're really able to give them that sense of calmness and feeling, especially because you've kind of grown up in this, so you've seen a lot in your years.
That's correct. I'm a second-generation dermatologist. My father started the practice 65 years ago, believe it or not. And I joined him after my residency at Mayo Clinic in '94 and practiced with him till he retired in 2005, but have continued practicing.
It just seems like it's so much more than, you know, a business for you, because I know that you guys have people coming in all the time, but it's really, it is about that comfortability, about making them feel welcome and understanding what can best work for them and how you guys can help them.
This is true. We have a lot of experience, and not only do we have the UltraShape, but we have other devices and procedures if this isn't the right procedure for that patient, or they need some additional fat reduction or skin tightening. We have a full array of body sculpting techniques at Booth Dermatology. Okay,
and of course it's not, you know, like just the tummy. I know we talk a lot about the show, like with dermatology, with our skin, our face, other problem areas. So come to you and, you know, be able to kind of calm those fears, because it's tough sometimes with people who are broken out or other issues that they have. You kind of want to have a tendency to hide away from that, to shy away from it, but it's like if you open yourself up a little bit, ask some questions. Maybe is that the first step? Just inquire about it?
Just come in and inquire, let us talk to you, take a look at you, answer your questions.
May have no idea just how you're going to be able to help them. After that, for sure.
Correct. It's not one size fits all. It's what's best for that particular patient.
Okay, so everything individualized and personalized as well. Okay, well, let's remind everybody where Booth Dermatology is if they would like to come on over and see you guys.
We have 2 wonderful locations, one in downtown Indianapolis at 320 North Meridian, and one in Carmel at 104th and Pennsylvania.
Wonderful. Well, a lot of great information. Thank you so so much
You're
for being here and for coming on. I'm sure we will see you again soon.
Okay.
All right. Thank you so much, Tracy.
Thank you, Amber. Two things we could use more of, art and soul. We're going to have more of both when we come back.